Welcome to the deep dive. Today we're really getting into something that touches, well, so many lives, but is often misunderstood. Generalized Anxiety Disorder, or GAD. And I think the big question for a lot of people is, how do you actually tell the difference between, normal worry maybe about a big meeting and that constant pervasive anxiety that is GAD?
That's a really important place to start because look, normal anxiety, it has a clear trigger, maybe that presentation, and then it goes.
Yeah.
You can let it go, usually. But GAD is, well, it's different. Imagine worry that's just excessive, it's persistent, and the key thing is it feels uncontrollable. It's often way out of proportion to whatever's actually happening.
So it kind of jumps around, not fixed on one thing.
Exactly. It shifts from concern to concern. And the official criteria, in the DSM-5 talk about worrying most days for at least 6 months about lots of different things and really struggling to control that worry.
Okay, so it's not just worrying more, it's that inability to switch it off, that intrusive feeling. Is that the real core of it?
That's absolutely central. That uncontrollable piece is the hallmark.
Right.
And it makes GAD different from, say, a specific phobia where you're afraid of one particular thing like spiders or a panic disorder with its sudden attacks. GAD is broader, more like a constant hum of anxiety.
It sounds exhausting just mentally.
Yeah.
But it doesn't just stay in your head, right? How does it actually show up physically for someone?
Well, definitely not just mental. That's a crucial point. The physical side is significant. Psychologically, yes, you've got the overthinking, maybe fear of making mistakes, feeling constantly wired or on edge, difficulty concentrating. Sometimes the mind just goes blank. But physically, that's where you see things like chronic fatigue, major sleep problems, falling asleep, staying asleep.
Right.
Muscle tension is a big one. Headaches, heart palpitations, even stomach problems like IBS symptoms. It's not in your head. It's your body's stress response system stuck in overdrive.
Wow, that sounds incredibly draining. So what leads to this? What causes GAD? It sounds complicated.
It really is a complex mix. There isn't just one single cause. You've got biological factors, things like brain chemistry, imbalances in neurotransmitters like serotonin or GABA.
Okay.
Then there's genetics. It definitely runs in families. If you have a close relative, like a parent or sibling with GAD, your own risk is, well, about 25% higher.
That's significant.
It is. And of course, environmental factors play a huge part. Things like really stressful life events, maybe past trauma, chronic illness, even substance use can contribute or make it worse. And it often travels with other conditions, especially depression. They frequently co-occur, which can make diagnosis and treatment a bit trickier.
Okay, so it's complex, but the good news is it is manageable, right? What does an effective approach look like?
Absolutely. There's a lot of hope.
Oh.
It's very manageable. And the best results, research consistently shows, come from a combined approach. Usually that means therapy plus medication working together.
Therapy like CBT, I hear that mentioned a lot.
Yes, cognitive behavioral therapy, CBT, is really a gold standard. The basic idea is to help you identify those anxious, often distorted thoughts,
Right.
challenge them, and then change the behaviors that sort of feed into the anxiety cycle. So techniques like cognitive restructuring, actively swapping irrational thoughts for more realistic ones, or even something called worry time, where you actually schedule a specific limited time each day to let yourself worry, to contain it, rather than letting it spill over everything.
That's interesting. Containing it. Are there other therapies making waves?
Yeah, mindfulness-based therapies are showing a lot of promise. They focus on helping you stay present, noticing thoughts and feelings without judging them. And what's fascinating is that this can actually lead to changes in the brain, like reducing activity in the amygdala, the brain's fear center. It's like retraining your brain's response.
Neuroplasticity in action. What about medication?
Meds can be really helpful. SSRIs and SNRIs types of antidepressants are often the first choice for long-term management. They work on balancing brain chemistry over time. Then you have benzodiazepines, like Valium or Xanax. They work quickly for intense, acute anxiety, but there's a risk of dependence. So they're typically just for short-term use, carefully monitored.
Makes sense. And beyond therapy and meds, what can people do themselves? Day-to-day stuff.
This is so important, the lifestyle piece. It really empowers you. Things like prioritizing sleep, consistent, good quality sleep. Regular physical activity is huge. Even just 30 minutes most days helps manage anxiety.
Yeah, I've heard that.
Reducing caffeine and alcohol, eating a balanced diet, building and leaning on your support network. Friends, family, these aren't just nice extras. They are fundamental for managing GD long term. They give you tools you can actively use.
Okay, so wrapping up. GAD is definitely distinct from everyday worry. It's pervasive, impacts mind and body, has complex roots, but crucially, it is very manageable with the right, often combined approach.
Exactly. And one more thing to keep in mind is that GAD can often be a chronic condition. That means there might be periods where things are better and periods of relapse. So ongoing management, being proactive, is really key.
Right. It's not necessarily a one-and-done fix.
Precisely. Which leads to a final thought for you, the listener. Knowing that managing GAD, even when treatment is working well, is often an ongoing journey. What steps can you commit to embedding in your life consistently, even when you're feeling good? How can you proactively build that long-term resilience to really sustain your well-being?